People that have chronic pain, those are people that have tissues and organs that are suffocating, not getting enough oxygen. So you know right then and there, if you've got pain, you need oxygen.
Hey everybody, Dr. Axe here. Welcome to the podcast. So excited this week. We have Jason Tebeau, and we're going to be talking about infrared light therapy. We're going to be talking about oxygen therapy. We're going to be talking about magnetic therapy, some really cool different types of holistic treatments that help everything from reducing inflammation, increasing nitric oxide in your body, which is incredible for your respiratory system and your brain. And we're going to talk about brain health. We're going to talk about hormonal health. We're going to talk about a lot of different types of health today and how these natural treatments can help you achieve a higher level of health. One of the other interesting things I'm excited to talk to Jason about is his Superhuman Protocol. We'll be going through this combination of these three really unique, we'll call them protocols that can help you achieve a higher level of fitness performance, especially. This is something that a friend of mine, Ben Greenfield, loves, and others as well. So we'll dive in. But Jason is the leader of Da Vinci Medical USA. It's a cutting edge rehabilitation, and I'll just say really like wellness science company that works with doctors, renowned doctors all over the country, and health professionals and consumers, and training them on using a lot of powerful techniques to help people heal more quickly. He's got 20 years of experience in the industry. And I want to say, hey, Jason, welcome to the program.
Thank you, Josh. It's an honor to be here. Thank you again for having me. Very, very cool intro. Thank you. So when we look at what's really going on here, yeah, there's technologies, but what we're really doing is borrowing from Mother Nature. Okay, the universe created a beautiful system. We just ruined it, and we disconnected from it, and it's declined, and we didn't even realize it. And so what we focused on, what are the three elements? We can call them elements, you can call them forces, that if deprived from, we would perish. Well, you and I both know that oxygen and light are critical. And a lot of people don't realize how important magnetism is. And you walk around Mother Earth as an earthling, and you absorb about half a Gauss when you walk barefoot. A refrigerator magnet's about 20 Gauss. Let's say you're hanging your family photos on the fridge. That's 20 Gauss. Earth used to be 2.5, 4,000 years ago. It's gone down 80%. It's half a Gauss now. That's 50 microtesla for the nerds out there. Now, our feet are really great at absorbing those free electrons and picking them up. And it charges our cells. Just like this cell phone, when it dies, what do? We put it on our induction charger, right? Your feet on the ground is in essence an induction charger. And that shifts our pH back into an alkaline state. When your cells are charged, they're now alkaline. So negative 25 millivolts on a cell is actually a pH of 7.35. So while we're walking around in shoes and driving in cars and on first floor, second floor, third or higher, we've disconnected from that which helped create life, and it declined. So we unknowingly disconnected from the very thing that kept our cells charged. Now, why is that even important? If a cell gets charged, it repels the other cells. And now every cell can get what? Oxygen and nutrients and carry it to the 11 organ systems. It's a beautiful symphony. Now, without that magnetic field, we actually can't get oxygen. So put you in a Faraday cage, right? Made of nickel alloy, block all the magnetic fields that Earth provides us. You'll go into defib in 10 minutes. Jane Hunt did that study with NASA. People don't realize how important oxygen and magnetism are as cousins. They're married almost. Okay, without one, you don't have the other. So if we can get our feet on that ground more often for long periods, we can actually charge. And then the body gets what it needs to restore order, because the body is a self-correcting device 24/7 if you give it what it needs. So yes, if we give it all the great ancient nutrition, we give it everything that the body loves, then it'll do its job. But if you have blocks there, if you have impedance somewhere in that mechanism between digesting nutrition and metabolizing and utilizing, then all the nutrition in the world doesn't work because you blocked the uptake. So believe it or not, the earth is our biocharger. Well, here's the problem there. I don't know about you, but I'm not walking around barefoot 24/7. It's not convenient. It's not practical. And if you live in the desert, you're going to fry with the sun. The UVA, the UVB is going to cook you. So how do we solve that problem? That's what PEMF is all about, pulsed electromagnetic field. It's been around a long time. It got its first FDA clearance back in the late 70s for non-union bone fractures. And as a ex-chiropractor, you know that bones are piezoelectric. They respond to a magnetic field. They'll actually start remodeling, right? That osteoclast and osteoblast remodeling architecture of the bone will begin whether you put stress on it or not. So in the world of PMF, there's high power, there's low power. We're working with the very low. We're simulating Mother Earth. Where in nature do we need to go beyond half a Gauss? Where in nature do we see that? We don't. So we're simulating what Earth's giving us. So we have a device that lets you lay on a mat for 8 minutes, and you have the residual effect of 14 hours. So you're alkaline, you're charged. Your blood flow goes back to that of a 10-year-old in 8 minutes for 14 hours. Now, if you're doing it twice a day like you should, you're constantly alkaline. You're constantly in a state of ultimate or optimal perfusion, the movement of blood, oxygenated, nutrient-rich blood to the extremities, to the 11 organ systems. So that's one of the elements, and it's critical. And if our Earth's core stopped spinning and that magnetic field went away, we're all in trouble. Forget about the heat shield, but that's a whole nother animal in itself. But we don't realize that the very element that kept us supercharged and healthy, and if a cell can get oxygen, a cell has a lower chance of becoming cancerous. So you want as much O2 into the cell as possible. So let's separate those cells, get the voltage up. So what we're doing is we're looking at stacking technology, stacking Mother Nature. So we look at PMF therapy. How do we make PMF even more effective?
So Jason, I'm going to stop you there quick.
Yeah.
So I have a few questions for you. So what I want to do is break down these individually, and then I want you to then talk about, and I'll ask you these questions, and hey, how do we put these together? So let's go ahead. Let's go back here. Let's talk about magnetism. Let's talk about, because we've heard, my audience is familiar with earthing and grounding, but to talk about what is earthing and grounding, and what is some of the technology out there to help us, because we are not outside barefoot all day long and sleeping outside on the ground like a lot of our ancestors did. Talk to us about a little bit more about magnetism, but also earthing, grounding, and then the technology today that you use to help people in terms of get these beneficial magnetic impulses.
Right. So grounding and earthing, also the same definition, is walking barefoot. Okay, getting your feet right onto the ground, even on cement, because cement has water in it. It'll actually conduct. So just walking around barefoot will actually charge you. So if you did, let's say we pricked the finger and we looked at our blood right before we did our grounding, and we see blood and all the cells are sticking to each other, we call that rouleau or cell clumping. That's also a sign of very low cell voltage or low pH, an acidic environment. Walk around barefoot for just 45 minutes, come back and do that same prick on the finger, look at the blood under a slide, called dark field microscopy, and you'll see all the cells separate, and they all look very round, and they're actually swimming around. They have this, what we call zeta potential or electrical potential. So they're like hard-boiled eggs with the shells off, slithering around in olive oil. This is the holy grail to cellular health, and you get that by just walking barefoot. And there's quite a few studies that are actually published that go all the way to watching symptoms, and I've got to be careful, with autistic children seeing benefits by walking around barefoot. Okay, so great. There's a great video online. We could talk about that later, probably be a link on our site where you can actually get the full documentary on what's called grounding or earthing. So we have technology for that, and it's simply a body mat that you lay on, and it's controlled by a little computer. Looks like a yoga mat. Little computer with a couple buttons on it. You hit start, you set your programs up. It's very easy. Hit start, and you lay there for 8 minutes. And a field of magnetism, half a Gauss, will come through the body. Okay, it'll go through 18 inches, and it also sends in about 7,000 different frequencies to talk to different cell receptors and affect what's called ion transport. So the in and out movement of things like sodium and potassium into the cell. And this device also clears all the negative EMF, has a patent on clearing all the 5G, Wi-Fi, cellular, all that dirty smog everyone's complaining about. When you're on this PEMF mat, not EMF mat, PEMF mat, you're in a sanctuary. So for that 8 minutes, you're getting back what Earth provided us. You're getting charged, you're becoming alkaline, and it'll last for 14 hours.
So PEMF stands for pulsed electromagnetic fields.
Correct.
Cool.
And it's probably one of the most adopted technologies by our chiropractors.
I was going to say too, it's pretty amazing that there is some great research on earthing and grounding and it improving sleep, it reducing inflammation and it fighting disease. And I think, I think about this, like Chelsea and I have a place with her parents. We go down with her parents to this place in the beach down in Santa Rosa Beach, Florida, not far from Nashville, maybe like an hour flight. And anytime we get there, the first thing we typically do is like, hey, we throw on our swimsuits, we walk down, and there's something like you get down there by the ocean and you put your feet in the sand, and it's like all of a sudden it's like, like this deep breath, this thing starts happening. Like everybody has experienced and felt that. And two, it is a similar thing. I feel like to maybe not quite the high degree, but pretty close. When you just then go and kick off your shoes and go and walk in the grass, there's this thing that like all of us feel. And listen, that thing, it's not just a psychological feeling. Things are actually happening.
You're 100% right. In fact, when my wife and I travel there, we typically go to the Caribbean, and it's, a few hops. It's a long flight, and you're tired and you're achy. And as soon as we get there, a green drink, and we go walking on the beach and say goodbye to all that pain. Seriously, all of it. And then you kick your circadian rhythms back into gear, because wherever you are, when your feet are touching the ground, your circadian rhythms, your sleep cycle is reset back to that time zone. So you fly out to New York, or you fly out to Paris rather, for months at a time, weeks at a time, you come back and your sleep is off, go ground. Go do earthing where you are, and your circadian rhythm will come right back in, and you won't feel that jet lag. This is real.
So now you have this mat you had referenced earlier, and it's pretty amazing. I know I've got one. I started using it. Talk about how that works specifically in terms of, and then, well, how is it more, I guess it's a little more potent. It's a little bit more, you're getting stronger signals at once, but we need those stronger signals because we're not outside 24 hours a day touching the ground. So we need a little bit of a higher input.
Correct. So if you're walking around in shoes already, or you're in a car, you're already disconnected. Your actual connection to earth and your Gauss has dropped quite a bit. You can measure that. I mean, you can take something like this called a tri-field meter, and you can measure radio frequencies, volts by meter squared, all that fancy stuff. And you can put it on the ground and measure it. And the higher off you come from the ground, the lower the actual Gauss is. So we are disconnected by the very fact that we're wearing these shoes and driving around in vehicles and airplanes and trains. So this is why animals, you don't hear animals coming down with end-stage cancer, fibromyalgia, ischemia, Parkinson's, right? They're walking barefoot. Horses love it. They go find a shady spot in the tree. What do? They actually sit down. They love it. Dogs, they'll go outside, they'll go sit down. On our PMF device, we have 2 cats. We're not going for a third. The cats will automatically jump up onto the mat, and they'll sleep there. Now, if I'm not on that mat, they're not attracted. So these animals are attracted to this. So it's this innate force that we know we should be getting. And because it's invisible, we all sort of just go, okay, I heard about it, but I can't really see it, and I really can't feel it. Well, you just mentioned it. You go walk on the beach and you have back pain, that back pain's going to go away. That's better than 200 milligrams of ibuprofen. It's completely natural. So because you just increase the blood flow, you increase the oxygen to the tissues that are inflamed because they're choked off, because they're hypoxic, meaning they're starving of oxygen. And you just gave all those inflamed, painful tissues, a bath in oxygenated blood, and that reduced the inflammation. And that all happened by you just walking around barefoot. So the device is going to kick in at 50 Gauss every time. It's maximum power. You can actually increase it by using a special applicator on certain body parts at a much higher intensity. So let's say you want to work on the liver or the pancreas, or, let's say it's that time of the month for those ladies and they're having cramps. You can actually put that right over the abdominal area and completely squelch that discomfort. Okay. So in addition to that, it's not just this magnetic field that's charging. There's trillions of cells in the body. They all speak brainese. You don't know what that language is. I don't know. You don't know. No one knows what that language is. The brain knows what to tell the cells, and it affects the cells. So there's roughly 7,000 different frequencies that can be sent into the body to affect cell receptors, or the ears of the cell, and make the cells dance, do their job properly. And so this device sends in those 7,000 frequencies as if your brain is not functioning properly, and gives your body some assistance. Because sometimes the connection between here and the rest of you has impedance. Call that inflammation, toxicity, etc. So think of that PMF as the brain outside the body singing the song to all the organs and the cells so that they come back to life and they do the dance that they're supposed to do.
Yeah, and I would say, think about it like this. A lot of these things are, magnets are essentially, again, a lot of this has different, I'm going to use the word polarity in terms of the way that it works with the earth. I mean, we were created to, like nutrients. Like, we need vitamin D, we need vitamin C, we need zinc. Our body also needs these pulses in order for us to be healthy. And so I want to encourage you guys, you can go to Jason's website. It's DaVinciMedicalUSA.com, and you can actually check out here this PEMF mat that you can actually just use at home while you're laying down. You can sit on it. You can do different areas of the body. I want to encourage you guys to check that out at DaVinciMedicalUSA. Now let's talk a little bit about oxygen. One of these cool things I know that you talk about. So your Superhuman Protocol, we've got the magnetism and that polarity and giving our body that sort of essential energy that our body needs. The other thing is oxygen. And so you work with this oxygen trainer, which really I've seen professional athletes use this very, very frequently. Talk to us about some of this oxygen therapy.
Sure. So we'll bounce back to PMF for just a nanosecond here. Right after you do PMF, your oxygen absorption can go up a minimum of 30 to 900%. That's how impeded the oxygen uptake or absorption is in a lot of people. So the window of opportunity for oxygen is right now, right after PMF. Okay. So we now put you in a device. Won't mention the name at this moment, but it's considered exercise with oxygen therapy. In fact, you wear this mask, got a little prop here, and that mask will have a hose through it. And the hose will come out of here and connect to a very large 900-liter cylinder, about 28-inch diameter cylinder. And so what you're doing is you're exercising for 15 minutes while you're breathing 93% oxygen. And you're forcing oxygen to distal hypoxic tissues. That's a fancy way of saying tissues that normally wouldn't get oxygen because the heart rate isn't high enough to force it beyond the norm, going into what we call the venous end of the capillaries, or through the endothelial lining into interstitial fluid. Getting it right through the artery wall kisses those cells and opens up the diameters, and they go back to normal. Now, this is steeped in science and research. Dr. Manfred Van Arden from the Van Arden Institute back in the late 60s did over 10,000 studies across 200 disease states. And all 200 disease states saw an 80% or higher improvement. This is unheard of. No side effects. And they were just breathing 50% oxygen while they were going hyperthermic, meaning they were in a sauna and they got their heart rate up, because some of these individuals were too old to actually get on a bicycle and get their heart rate up. So we can do that with hyperthermia or a sauna. So in this case, most people can get on a treadmill, elliptical, exercise bike, they wear the mask and they breathe this oxygen. Immediately, they're going to see this become a discomfort buster. Okay, I've got to be careful with certain words. This will help you sleep like a baby. ATP, adenosine triphosphate, or also known as ATP, or energy chemical. This is not just a word that we're throwing around. A lot of people go, oh yeah, improved energy. No. When you get more oxygen into more cells, the cell can make ATP properly. And in fact, if you can get 1 billion molecules of oxygen to every cell, which you can if you do PEMF first, you're optimizing ATP production. And we'll talk about how to get nitric oxide up at the same time in the next modality of light therapy. So oxygen's just being forced to those tissues that have been starving of oxygen for years. You put a tourniquet on your arm right now, Josh, okay? The rest of the arm's going to start to swell and what? Start to hurt.
Yeah.
Right? We take that tourniquet off. What do we have? We get our arm back. The blood begins to flow. Think of your microvessels thinner than your hair. A lot of those are inflamed and they're shut. And those are in effect, have a tourniquet on it. So when you can't just breathe this oxygen sitting there, won't work like that. You've got to get your heart rate up over about 110 beats per minute. That's when your partial pressure, which is a fancy way of just saying the arterial pressure inside versus outside, goes up high enough to push all that oxygen to tissues that haven't seen oxygen for a long time. And people that have chronic pain, those are people that have tissues and organs that are suffocating, not getting enough oxygen. So you know right then and there, if you've got pain, you need oxygen. So you just exercise for 15 minutes. Every 3 minutes, you do an interval sprint for about 30 seconds and do your best. Get your heart rate up as not too high. There's a protocol. And then you calm back down for 3 minutes and repeat. And, look at viruses and bacteria. They're anaerobic. They can't survive in oxygen. They just can't. You increase the pH, you increase the oxygen content of the blood plasma itself. These anaerobes can't survive. They certainly can't thrive. You put a virus in a petri dish in a lab and you crank up the O2 in the room, bring that up into just 60% purity. Apoptosis. That cell dies. Very difficult to do that in the human body, except with this system, because you're doing it under load for 15 minutes and you're forcing 93% oxygen into all of the tissues that need it. And it has a long-term durable effect between 6 months and a year. And it's been touted to be equivalent to 20 to 30 hyperbaric chamber sessions in just one 15-minute session.
Wow. So this is like hyperbaric chamber on steroids in terms of the power, in terms of the benefits. And so I want to encourage you guys, hey, if you want to check out some of this technology too, you can go to DaVinciMedicalUSA.com. And on his site, you can go to view all products and also just contact. There's contact in the right corner. There's a phone number. And if you're interested in getting set up with any of this technology, whether it be the magnetic pads, whether it be, this oxygen therapy we're talking about, you can talk to Jason there. And I also want to mention, this is really powerful for health practitioners. One of the things that Jason has done, I know because I have some friends that have done this that run functional medicine clinics, is he has gone and partnered with doctors in getting them set up to where patients can go and get all of these therapies. They can go in to their doctor and they can get this oxygen therapy. They can get the magnetic therapy, and they can also get, we're about to talk about, infrared light therapy, which is one of the most powerful of them all. And so if you're a practitioner, whether it be a medical doctor, a chiropractor, an osteopath, PT, or any type of practitioner, I want to encourage you, reach out, go to DaVinci Medical USA, call or send an email under contact, and Jason will be happy with you to jump on the phone and walk you through some of the results they've seen in practices and what you can do with some of your patients and clients. Jason, so let's go ahead and dive in. I want to talk about infrared light therapy. Now, I've been using your products in this. I've been using this infrared light therapy, and I can tell you, I was surprised how much it improved my sleep. I was actually improved my strength.
Yep.
Like I went and did squats and deadlifts the next few days, and I could tell, and again, I'm not saying, I actually could tell I was stronger.
Yep.
And it was so surprising that my sleep was better. You could tell inflammation a little bit different, the joints just a little bit there, but then also the strength was up. Talk to me about what are the benefits of infrared light therapy, and where does this technology come from?
Sure. So we call it in the clinical world PBM, photobiomodulation. It was formerly known as low level laser therapy, LLLT. So it comes from class 3B and class 4 lasers, right? So a lot of chiropractors have these devices. In fact, I don't have my prop in front of me, but it looks like it's just a handheld piece, and they rub it very slowly over the injury area. And it's red and near infrared light, but it's very powerful. Like you wear goggles, the whole 9 yards. You have to protect your eyes from this. And that reduces pain, 5 points on the pain scale in one session in some cases. So this has gone back about 30 years, where they discovered that shining light on certain cells has an effect. And over the years, they've developed these lasers, these pain management, accelerated wound healing devices. There's class 4 now. Josh, I know you have a Summit, and that's a very, very powerful laser. That's a 20-watt laser. So that same company makes a full body light bed that you don't need goggles when you get in it. You can leave your eyes wide open. So now we have 45,000 LED lights, and they're divided evenly by 4. We have red, and then we have near infrared. So this is not a sauna. This does not get hot. As you'll attest to that, Josh, you don't sweat in this. In fact, it'll pretty much stay the temperature of the room. It gets a little warm because it's electric, and there's some drivers in there that dissipate the heat from all the light. But what it's doing is the red is great for the skin, okay? Epidermis, dermis, hypodermis. And what's happening is when that light gets absorbed. In fact, if you shine the white flashlight on your palm right now at night, and you'll see the white light just come right through. You'll see this white glowing area. But you take a red light and do that, you won't see any red here. It won't go through because it's absorbed. So it's being absorbed by the cells. And what happens when the cell absorbs this light, a phenomenon occurs, and there's something called a free radical in the cell. They're burglars. They like to steal things. They like to make the cell age. This particular burglar is called mitochondrial nitric oxide. And when light hits the cell, it kicks that burglar out. And now that cell isn't oxidizing, because that free radical is causing oxidative stress. Kind of like when you open up an apple, it turns brown. If you put lemon juice on that apple, it'll slow that down. Think of light as lemon juice for the cells. I like the analogy where you've got a house at night, there's a bunch of burglars stealing things, and someone turns on the floodlights. All the burglars go running for the hills. And some of them are blinded by the light, and they run into the fence. Well, in the body, let's call the fence the artery wall. So when a free radical, mitochondrial nitric oxide, runs into that artery wall, it relaxes the artery. It actually helps it vasodilate. It improves blood flow. So when people say light creates nitric oxide, it does not create nitric oxide. It kicks the nitric oxide that has an affinity to stick inside the mitochondria. It kicks that bad guy out. So there's not so many of them, and they're competing because oxygen is supposed to come in and dock and make ATP. So Josh, when you said you got stronger, yeah, you push the bad guys out, you let oxygen come back into the house to make ATP happily ever after again. So your strength went through the roof, but your cell now optimally makes that energy. It's not aging as fast. You're slowing it to a crawl, and has a massive cascading effect. Great looking skin, teeth, hair. Your organ systems start to regenerate. Your sleep improves because the oxidative stress, which is the inflammatory condition that is, in my opinion, the root cause of just about every condition known, you're putting the brakes on that with light. And you have the benefit of being able to get in that every single day. One really cool thing about that is light will thicken the collagen, and you can, use your product to enhance that even further. But when you thicken collagen or thicken those substrates, you actually are preventing the body from future sunburn. So the science is that if you're consistently using red light therapy, you're reducing the risk of sunburn overall. So if you were to stay out in the sun for a certain period of time, we would measure how sunburned you became. But if you were doing light therapy, that would probably drop by 30 to 60%. So it's a protector. Basically, think of it as your shield against the sun.
And let me say now, this type of light, you're talking this infrared light, this is not the type of light you're going to get middle of the day, the blue light that you get from other things. This red light is really unique. And talk to me about specifically as well, like when you have somebody do this, and I probably hit on a few of them, but what are the biggest benefits? Let's say 3 to maybe 5 benefits. What are the top 5 benefits people tend to see when they're using this really unique form of red light therapy? And I think people are probably familiar. Maybe you've seen, and I want to say this too, you may have seen ads on Facebook or Instagram now. Like you may have seen Google ads. Like people now are starting to use infrared light therapy. But like anything, I do want to mention, it's not all created equal. There are companies out there putting out devices that are, under $100, even a little bit over $100, and it's not the same thing. I mean, this is medical grade. We're talking about very unique red light therapy. But talk to us, Jason, about when people say, "Hey, these are the top benefits I see."
Yep.
What are the top benefits people tend to see when they use this?
Exactly. And so we have over 150 clinics right now with the light bed, and they're almost all of them are doing the Superhuman Protocol, and I talk to them all the time. The biggest benefit is pain relief.
Wow.
In one 10-minute session, somebody that comes in with chronic pain, they're seeing it wiped out 30%. Second session, another 30%. That's unheard of. Also, they claim that patient is able to stay awake longer and have better mental and visual acuity. So sort of like the lights got turned on. So energy, so strength. Athletes are making claims that they're able to work out harder and longer in the gym and recover much faster. And then we're hearing that other one, which we know has a clearance, FDA clearance on some devices. People are watching some of those unwanted pounds just melt away. Okay, so between pain relief, improved strength and range of motion, adjunct to obesity and an obesity plan, these are the big ones. And then we can get into the subtle nuances. But I wanted to address that comment. You're right. These are not created equal. There's a lot of beds out there that are missing the boat. There's a couple diodes that are super expensive. One of them in particular is 810 nanometer. That represents the color, like 635 is red. That's 635 nanometer. So that defines the length of the actual wavelength itself, how deep it goes into the body. So we use 4. And so all 4 do the same thing to the cell, but they do it at different tissue depths. And 810 is in your class 4 laser, by the way. That's the common denominator. So when you look at some of these other less expensive beds, they don't have 810 because it costs 10 times more for that one diode to be in that bed. So they kind of take the less expensive manufacturing route and they just fill it with a bunch of red. Okay, well, that's great. If you just want to affect most of the skin, it's like my wife kissing me on the cheek and the lipstick is right there and it just washes right off. But if you want to do the deep dive and go into musculoskeletal, into organs and all those tissues, you've got to have the 800s and the 940s, especially the 810, and of course, red. So, this is manufactured by a company that's been making FDA cleared class 4 lasers. There's only 2 companies in the world that actually make cleared lasers, meaning FDA cleared, proven outcomes, efficacy, that also make a bed. And we carry that one of the 2. So yeah, you have to be careful because when we're selling into clinics, this is their livelihood. They've got patients that come in, they need an adoption rate. They need the patients to see these amazing results. We have one doc who's a chiropractor. She did a test with 75 patients over 2 weeks, and she just did 5-minute sessions. And she said, this became the pinnacle of my practice, and that video is on YouTube. That's pretty compelling for a chiropractor who's a class 3B laser expert and has every toy on the planet. Light bed was her saving grace, and it's busy full time. She needs a second bed. Wow,
it's amazing. And so I do want to mention, one of the things I think that when we tend to hear about things our body needs. We obviously talk a lot about nutrition, and of course that is critical to healing. But at the same time, there are other things. Again, we need oxygen, we need light, certain types of light, especially this type of red light. And also, we need this polarity from this earth, this magnetism, that we get the benefits from earthing and grounding out there. And so I want to encourage everybody, hey, follow a really good diet that we talk about all the time on this show, all of these principles. We also need to follow a proper lifestyle of having plenty of love and hope and joy in our life. In addition to that, though, I really believe God created us to be outdoors in nature. And there's a lot of these things that we are not getting enough of. And so, hey, I want to encourage you, check out more about red light therapy, more about oxygen therapy and magnetic therapy and the benefits there. And hey, if you want a great resource, you can read additional articles. Go to DaVinciMedicalUSA.com. I want to mention a few things. He has Jason here has a video there. If you click on Superhuman Protocol, again, that's DaVinci Medical USA. There is a Superhuman Protocol. There's a video on there, and you can watch, and he gets more in depth there on the PEMF, the oxygen, the light, and really how this works in your body. It's a cool thing, share it with a friend. I think it's a really interesting video to learn about. And again, this is something I've done. I have friends I know who have used some of this different technology, and the results have been incredible. Just like we need vitamin D, just like we need zinc and these nutrients, we need oxygen, we need light, and we need this magnetism and things like clean water. There's another example as well. I want to say, Jason, thanks so much for coming on the show today.
My pleasure. Absolutely. I want to add one thing that we mentioned in the beginning. We stack. So when we do magnetism followed by oxygen followed by light, you put each of the next technology on steroids. So each influences the next, makes that technology even more effective. So that's why we do it in that order. It was originally nicknamed Earth, Wind, and Fire, right? Earthing, oxygen, wind, fire, light. So yeah, we do those three in that order. And when we get those three elements in magnitude order, in the right order, we can restore order.
I love it. Again, check it out, guys. DaVinciMedicalUSA.com. Click on the Superhuman Protocol. You can learn more there. Thanks again to Jason Tebeau of DaVinci Medical. Thanks so much, Jason.
Thanks, Josh.
This podcast is for information purposes only. Statements and views expressed in this podcast are not medical advice and have not been evaluated by the Food and Drug Administration. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. In some cases, individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein.